Hey there everyone. In the previous video we had studied the muscle of the thigh with its origin, insertion, nerve supply and actions, and along with the diagrams. If you haven't seen that video, please go check out that video. And in today's video we are going to complete the femoral artery, the femoral vein and the femoral nerve. Okay, these topics are very much important because can be easily asked for 10 marks or like 5 marks. The definition and then the course, extent, beginning, termination, branches and boundaries. Okay, so let us start with the femoral artery first, and then we'll go to femoral vein and then end with the femoral nerve. Okay, what is femoral nerve? Okay, femoral artery, the definition. Okay, the femoral artery is the chief artery of the lower limb, okay, which supplies the lower limb. It is a chief artery of the lower limb, so this becomes the definition for the femoral artery. Okay, and mention this point that developmentally it is not derived from the axis artery, but the gluteal artery is derived from the axis artery. Okay, now see the beginning of the femoral artery from the common iliac artery. It arises from the abdominal aorta. Okay, the common iliac artery divides into two branches, that is the external iliac artery and the internal iliac artery, and the external iliac artery continues as the femoral artery. Again it continues as the popliteal artery. Okay, so on the internal iliac artery it branches into the anterior division and the posterior division. Again it gives branches and supplies different muscles and different muscles. Okay, so see, this is the external iliac artery and then it continues as the femoral artery. Okay, see here the beginning is continuation of the external iliac artery. It arises from behind the ilio-inguinal ligament at mid-inguinal point in the mid suppose so this is the, okay, not like this, so this is the ilio-inguinal ligament. So it begins from behind this. Okay, it begins from behind this at the mid-inguinal point. Okay, so this is the beginning of the femoral artery. And now we are going to see the course, extent and its termination. Okay, so see, as I had already told, the inguinal ligament and the femoral artery in the femoral triangle, then the adductor canal. We will also study the adductor canal in the upcoming videos. So see, this is the adductor magnus, tendinous opening of the adductor magnus, and then continues as the popliteal artery on the posterior side. See where its extent is from the inguinal ligament into the femoral triangle, then the adductor canal, then the tendinous opening of the adductor magnus and the popliteal artery it continues as. Okay, now this is the termination of the artery, termination of the femoral artery. This is the beginning and this is the course or extent of the femoral artery. We are done. And the clinical importance of the femoral artery, we will study it in the next chapter. You have to also write the clinical or the applied anatomy in the answer. Okay, so now we are going to see the attachments or the borders of not attachments, the borders. Okay, see, this one is the artery in the center, and to the medial side, this is the medial side, this is the lateral side. On the medial side we have the vein, on the lateral side we have the nerve. Okay, the artery is in the middle, on the medial we have the vein, on the lateral we have the nerve. Okay, remember this. Okay, lateral side पे nerve है, medial side पे vein है, and artery is in the between. See, now we will see that this is the femoral sheath that we have already studied in yesterday's class. Okay, this is the femoral sheath and this is the vein that is to the medial side, and the nerve that is to the lateral side, and the nerve that is the femoral nerve, it is not inside the femoral sheath. Which nerve is in the femoral sheath? It is the femoral branch of the genitofemoral nerve. Okay, so the skin and fascia, okay, we know this, and this is the artery, the vein, the nerve, and this is, see, these are the muscles. This it is from by the muscles, that is the adductor longus muscle, pectineus muscle and psoas major muscle. How do you remember this? Remember app. Okay, app, we use applications and app, right? So A for adductor longus, P for pectineus and P for psoas major. So this gets easier to know the things. Okay, see, anteriorly by the skin and superficial fascia, we saw here skin and the superficial fascia, and anterior wall of the femoral sheath. See, the green is the femoral sheath, anterior wall of the femoral sheath, very easy it is. Posteriorly by the posterior wall of femoral sheath, and posterior it has muscles. Which muscles? Ab muscles. Which ab? Adductor longus, pectineus and psoas major muscle. Okay, on the medial side, we saw here on the medial side we have the vein, lateral side we have the nerve. So see, femoral vein, lateral side femoral nerve. Done, understood, very easy it is. Now branches. Okay, the branches, see, first we will see this. The femoral artery divided, it gets branched into 3 superficial arteries and 3 deep arteries: the pudendal artery, epigastric artery, circumflex iliac artery. We have already studied this in the second video of the second video of the lower limb, that I've already covered very nicely. Please go and check that out if you haven't yet seen that. We have studied all this. Okay, and the deep is the profunda femoral artery, and the deep pudendal artery, and the gives muscular branches. Okay, see, what the pudendal supplies, it supplies to the skin and the external genital organs. Epigastric, by the name we can understand the lower anterior abdominal wall and its skin and fascia. The circumflex iliac, it is in the name itself, it supplies the iliac crest, regions of the iliac crest. Okay, and the profunda, the profunda femoral artery. This is very important, please remember this, add a star mark. Okay, star mark, that it supplies all the 3 compartments of the thigh, that is the anterior compartment, medial compartment and the posterior compartment. Okay, let's see the branches in the diagrammatic way. So see, I had already told the abdominal aorta, and then continues as the common iliac artery, divides into the external and the internal. The external continues as the femoral artery. See, this is the this green one, it is the inguinal ligament. Okay, it is coming arising from behind the inguinal ligament. Okay, so see, it gives branches to the muscles and to the joints. Okay, so this one we had already studied this one in the previous video, in the second video of the lower limb. So this is this is a sphineus opening. Okay, here, and this is the deep pudendal, and these 2 are the superficial, that is the pudendal and the epigastric, and then on the right side we have the superficial circumflex iliac artery. We have seen this already. Okay, these are the superficial branches, these 3 are the superficial, and this is the deep pudendal artery that supplies the genitalia. Okay, and see, downside, it gives a branch called as the profunda femoral artery, a very important branch of the femoral artery, the profunda femoral artery, because it supplies all the 3 compartments of the thigh. Okay, it divides into 2, that is the lateral circumflex femoral artery at the lateral side, and medial circumflex femoral artery at the medial side. How easy it is, right? And a branch, so this is the femoral artery, as we all know. So see, and again branches from 1st to 4th perforating arteries for the muscles. Okay, and then below it gives 2 arteries. Popliteal artery, it continues as a popliteal artery for supplying the popliteal region, and the descending genular artery. Okay, so remember, this is very easy if you understand it and draw the diagrams 1 or 2 times. It will be set in your mind always, and you will always remember it. Now we are done with the artery, we are going to go to the femoral vein. Okay, the femoral vein is the vein that is in the femoral region, and it collects the blood from the, you just can write a definition like that. And see, it begins from the popliteal veins, becomes the femoral vein, okay, then in the adductor canal it then terminates as the iliac vein. Okay, in the iliac vein, so it is opposite, right? Always veins are opposite to the arteries, right? So behind the inguinal ligament, even this goes behind, and it is medial to the femoral artery. We saw here, right? It is medial to the femoral artery. See, it is medial to the femoral artery, the femoral vein, it is medial to the femoral artery. So now, yeah, see here, it is medial to the medialis, right? It is medial to the femoral artery. See, it is beginning is from the popliteal vein, course and extent to the femoral vein in the adductor canal, then behind the inguinal ligament it terminates or continues as the iliac vein. Very easy, its beginning, extent, course and termination is very easy if you understand the diagram itself. Okay, so now it's done. Its branches are not given in the textbook, just the extent, course and termination of the vein okay, vein. Now we are done with the vein. We are studying the femoral nerve. Okay, femoral nerve definition: it is the chief nerve of the anterior compartment of thigh. It is very important, a nerve that supplies to all the muscles of the anterior compartment, like the sartorius, quadriceps femoris, the articularis genus muscle, and all the four muscles of the quadriceps femoris muscle. All muscles of the anterior compartment of the thigh supplied by the femoral nerve. Femoral nerve is coming from, see, its origin and root. See, its origin is, it is the, remember that it is the largest branch of the femoral plexus. It is originating from the anterior primary rami of L2, L3, L4 spinal nerves on the dorsal side. See, I have shown here. See this red one, the with the red color, whatever you see here, this is on the dorsal side. It is the femoral nerve, and the same roots on the ventral side forms the obturator nerve. Okay, remember the difference. So these are the branches. Draw the diagram. Okay, draw the diagram when you're writing the answer in the exam. So this red is the femoral artery, medial to it is the vein, as we discussed earlier, and lateral to it is the femoral nerve. It is lateral to the femoral artery. Okay, it is lateral to the femoral artery. Alright, now we are going to see its branches, right? See, L2, L3, L4 on the dorsal side gives the femoral nerve, as I already told you. So it gives branches as the iliacus nerve on the iliac region, and pectineus nerve for supplying the pectineus muscle, because it is present to this side, and the iliacus cell is present to this side. Okay, so this is the pectineus nerve, the iliacus nerve, and again it gets divided into the rectus femoris muscle and the sartorius muscle. Remember, the sartorius is on the medial to this side, and the rectus femoris on this side. So this is the rectus femoris and the sartorius muscle. See, pectineus and iliacus, not okay, this is not strictly the muscle of the thigh. Okay, the rectus femoris and the sartorius nerve, again it gets divided for the vastus compartment. See, the vastus lateralis muscle, vastus medialis muscle, and the vastus intermedialis muscle. Three branches for that, and one more muscle was the articularis genus muscle, that was pulling the superficial bursa, synovial bursa upside, right? So this is the it supplies the articularis genus muscle, and this supplies the knee joint. Okay, this supplies the knee joint. And for this we have the sphenius nerve. Okay, the sphenius nerve, this branch gives continues as the sphenius nerve, and on this side of the sartorius we have the intermediate. See, this is the intermediate and this is the medial, right? Because this is the medial side and this is the lateral side. For the medial side we have the intermediate and the medial cutaneous nerve of thigh. So where is the lateral cutaneous nerve of thigh? We had seen that it is arising from the L2 and the L3. It is arising like this. So this is the lateral cutaneous nerve of thigh, and from this we have, from the sartorius branch we have the intermediate and the medial cutaneous nerve of the thigh. So intermediate ho gaya, medial ho gaya, and lateral bhi ho gaya. So see, first it gives pectineus and iliacus, then it gives to the medial sartorius and the lateral rectus femoris and all the three vastus muscles, then the articularis genus and the knee joint. For here in the intermediate it gives the sphenius nerve, and the sartorius gives off two branches for the intermediate cutaneous nerve of thigh and the medial cutaneous nerve of thigh. So these are the branches of the femoral nerve. We are done with the definition, the origin and root, the formation, and we have seen the extent, we have seen the branches, we have seen the course, and we have also seen the diagram. So now we are going to do the adductor canal, which is very easy and very easy to understand, but it also is very important. So see, the adductor canal, its extent is above and below. Okay, it extends above and below. So above is the apex of the femoral triangle, apex of the femoral triangle, its extent, and below tendinous opening of adductor magnus muscle, adductor magnus muscle. Okay, we saw that the femoral artery also is its course. When we were studying the course of the femoral artery, we had seen that the tendinous opening in the adductor magnus muscle, it is going through that, and also this adductor canal is also. Okay, the shape of this is a triangular shape. Okay, see, this is the femoral triangle that we had seen. This is the femoral triangle. It continues from the apex of the femoral triangle and forms the adductor canal. See, it forms the adductor canal. Here only we have written, no, apex of the femoral triangle above, and below the tendinous opening of the adductor magnus muscle. Okay, tendinous opening of the adductor magnus muscle. So its boundaries are anterior lateral boundary, posterior medial boundary, and the medial boundary. Remember PM, AM, PM, right? So PM posterior medial, and this will be easy to remember. Okay, so see, boundaries on the anterior lateral, we have the vastus medius muscle. Posterior medial, we have two, above and below. Above is the vastus longus, and no, not vastus longus, the adductor longus, and below is the magnus. See, below we had already seen, no, tendinous opening of the adductor magnus muscle. So below, posterior medial to the below, it is the adductor magnus, and to the above we have the adductor longus. This is for the posterior medial. And for the medial, we have strong fibrous sheath joining AL, that is the anterior lateral, and PM, that is the posterior medial walls. It is joining, okay, medial side is joining, overlapped by which muscle? The sartorius muscle. Okay, so see, anterior side we have vastus medialis, posterior side above and below we have adductor. Okay, just remember PAM, okay, posterior medial, A for the adductor longer, and the adductor magnus, and this you can remember, that is the vastus medialis muscle. And for the medial side, it joins the anterior lateral and the posterior medial, which is overlapped by the sartorius muscle. So these are boundaries of the adductor canal. See, we'll see this in the diagram only. Diagram, if you're understanding by the diagram, it's very easy to write it down, write down the same in the points. Okay, see, this is the vastus medialis muscle. On the anterior lateral, we have overlapped by the sartorius muscle. Okay, then we have the adductor longus muscle, as we have already seen it upside, no. So see, this is the femoral artery and the femoral femoral vein. This is the obturator nerve from the L2, L3, L4 on the ventral side, and this is a nerve to the what is this? Vastus medialis muscle. And see, this one is not told. Okay, and these are the nerve plexus, and this is the subsartorial fascia. So this is the sartorius, and this is the subsartorius fascia, in which nerve plexus are present. And see, the contents are the femoral artery, femoral vein, femoral nerve, and then we have nerve to the vastus medialis, we have the plexus, we have the subsartorial fascia, we have the obturator nerve, and these are the contents. You have to write it down in words, and you are done. Thank you so much for watching this video. We are mostly done with the with this chapter. Only part that is left is the clinical anatomy. We'll complete it soon. We'll complete the clinical anatomy, and the chapter will be over. Thank you so much.